Okay. Hi, welcome everyone. It's Learning Disabilities Month, Dyslexia Awareness Month, and we are offering our Wednesday webinar as Debunking the Myths of Learning Disabilities. Hi, I'm Beth McGaw. I am the president of the board of the Learning Disabilities Association, and today we have Jennifer Topple and Monica McHale-Small. So I'm going to give Jennifer and Monica just a couple of seconds to kind of introduce themselves.
Okay. Hi, I'm Jennifer Topple. I'm actually the chair of the board of the International Dyslexia Association. I'm a speech pathologist by training, and I work as the director of language literacy and assistive technology at a school called the Howard School in Atlanta, Georgia. I'm excited to be here with you today.
Okay, hi, my name is Monica McHale-Small. Hope everyone can hear me. I am first vice president of LDA, and I am also the policy committee co-chair with Joanna Barnes. I am a retired school psychologist and school superintendent, and I also have a lot of passion around learning disabilities, not just because of my professional background, but because I have adult children who had learning disabilities. That wasn't my expectation when I started out as a school psychologist, but it has certainly made this work much more personal for me.
Great. Well, thank you. Well, we're really excited to get started today on this webinar, Debunking the Myths of Learning Disability. And this topic came out of a joint white paper that was written by a group of devoted IDA and LDA members called How Myths About Learning Disabilities Rob Many of Their Potential to Succeed in School and in the Workplace. So we're going to go through a little bit about that goes into that white paper, but if you are interested in that white paper, it is on both IDA and LDA websites, and so you can go read the full paper there. So let's get started. So learning disabilities cover a lot of topics, and these are just a few of them. Dyslexia, being probably is the top one. So what are learning disabilities? They're neurologically based processing disorders. They may impact an individual's ability to process, store, or produce information. They may impact one's ability to read, write, and spell, compute, or reason. And they can have co-occurring challenges with organization focus, listening, comprehension, social skills, motor skills, or a combination of these. So learning disabilities cover a wide range of cognitive disorders. And specifically, you may have heard some of these terms: auditory processing, I say dyscalculia, but you can say it in other ways, dyslexia, nonverbal learning disability, language processing disorder, dysgraphia, dyspraxia. All of these are types of learning disabilities. And notice that dyslexia is also a learning disability. Many of us will want to say learning difference. And it does give us a more comfortable feel when we say that. We all do learn differently. But individuals with learning disabilities need specialized instruction and accommodations in order to access the information. And a learning disability diagnosis is needed to qualify and receive appropriate services in school and accommodations for testing for college and in the workplace. So if you don't have that diagnosis of a learning disability, then you are not going to get the services that you need. So you've got to feel comfortable with using that word. You can use it with you can use learning difference with your friends, and family, but when you go to the schools to get the accommodations that you need, you're going to have to use the word learning disability. So Monica?
Oh, I'm on. Okay, so what we do know is that underachievement is a symptom of a learning disability, but it is not the sole criterion. Learning disabilities really involve cognitive processing deficits that impair an individual's ability to learn, to acquire new skills, to navigate learning, or to meet the performance demands in an educational environment. You can advance the slide now. Okay. One of the things that we know, and one of the reasons we're doing this webinar today, is that there's a lot of misinformation and misunderstanding about what are learning disabilities. And fully 1/3 of the population has inaccurate understandings of what it means to have a learning disability and what the potential of people who have learning disabilities really is. As you can see, I'm not reading these slides exactly, so I'm trying to talk to them. So what we do know is that research shows that about 1 in 5 children in the United States have learning and or attention issues. So not necessarily 1 in 5 with learning disabilities, but some sort of learning or attention issue. Learning disabilities are certainly the largest category of children who are identified and served in public schools under the IDEA. As many as 34% of the total population of students who are identified for special education services have a learning disability. And actually, in some more recent data, it might be even a little bit higher than 34%. As we said before, 1 in 5 individuals have learning disabilities or attention issues, and a lot of times those things are comorbid, they occur together. But learning can be impacted either by a learning disability or by an attention deficit or other deficit. Research shows that about 80% of the students who are diagnosed with a specific learning disability struggle with reading, and most of those meet the criteria for dyslexia. Okay, so the research also shows us unequivocally that children are best helped if they receive early and intensive intervention. Okay. Unfortunately, many children are not evaluated until after they have already experienced academic failure. One reason, or one of the contributing factors, is RTI, response to intervention, sometimes also known as MTSS, or multi-tiered systems of support. We believe that RTI and MTSS are an important and valuable intervention framework and prevention tool. However, it does not substitute for an evaluation. And we also know that children should not languish in a tier. If they're not making progress, then they need to either receive more intensive intervention or they need to be referred for an evaluation. Many individuals who do indeed have dyslexia or other learning disabilities do not meet the criteria that's established in various states or LEAs, local education agencies, or school districts, for who might qualify for special education services through the IDEA. Nonetheless, many of those individuals could still qualify for at least accommodations under Section 504. And people should know that individuals who leave the public school to receive their education in independent school settings no longer have the protections of IDEA and Section 504. Okay, we can advance the slide. Recently, back in April, there was a GAO report, a Government Accountability Office report, that was looking at what is happening with child find requirements. Child find is part of the IDEA. It's been a part of the law since the beginning. And what that means essentially is that school districts have to actively find those students who possibly have disabilities and may be in need of special education support and services. And what we know from this GAO report is that there are inconsistent state policies and practices, and these inconsistent policies and practices are resulting in a failure to identify students either timely and very early when intervention can best work, or at all, or they lead to misidentification. So differences in policy and practices result in different children being referred or not referred for an evaluation, even within within a single school district. It results in English language learners being either under or over identified. In some instances, they're under identified, but in some instances, what is really a language difference is called a learning disability. And then what also emerged from the GAO report is something that LDA has been very much aware of, is that RTI and inconsistent application of the RTI model and under-resourced schools and under-trained staff results in RTI actually becoming a barrier to proper evaluation and identification. Okay, so in other words, there are far too many children and young adults that are left undiagnosed or not diagnosed early enough in order to obtain the support that they need, and that will best ensure a successful future and academic experience. Okay, and I think
now we're going to debunk the myths. Jennifer?
All right. A few things that that people don't understand about learning disabilities. You hear the word disability, and a lot of times people think of, you know, someone in a wheelchair. Learning disabilities are often there's difficulty because you cannot see them physically. So a child is sitting in a classroom, and there's no obvious reason to a teacher why they may not be able to keep up with the work that is going on in the classroom. Also, a lot of people sometimes think that a child is just being lazy and does not have a learning disability. A lot of times what you'll see is a child will fall behind and get overwhelmed and not turn in assignments. And often this is misperceived as just not being motivated, being lazy, and just not participating in the classroom.
Yeah, and also sometimes, you know, parents may see this at home too, right? You know, when the kids may not want to finish their homework or may not even hand in their homework. And they think they're being lazy, when in fact that's not really the case.
Yeah, and especially with reading, I think when children fail at reading from a young age, sometimes they just decide that they aren't a reader, they don't like to read. And we often get at our school parents who we start to introduce things like assistive technology to kind of help the child build language while they're learning to read. And parents still want them to read out of the paper book for all of their reading. So I think there are lots of misperceptions around that as well. IQ. So although the research does show that about 43% of learning disabilities can be associated with low IQ, all individuals with learning disabilities have average to, well, there are many students with learning disabilities have average to high to above average intelligence. You can see, you know, some of the poster children for dyslexia and learning disabilities, people who have succeeded beyond all anyone would have suspected when they were in school.
Yeah, and this is a persistent myth that many people believe that being learning disabled means that you are, you know, cognitively challenged overall, not with specific weaknesses, but just overall you may be a slower learner. And this is simply not the case, as those pictures right there attest to.
Right, and that's what we need to also, you know, let our kids know, that you are smart. You just have some areas that we need to work on.
And I think when we treat children like they can be successful, they will rise. Children are born curious and wanting to learn. And I think we need to nurture that and not let sometimes the education system kind of creates a situation where they feel like they are unsuccessful and lose self-esteem. Another issue that comes up a lot is home environment, lower socioeconomic status, coming from kind of impoverished environments where maybe the parents haven't read to them, things like that. Those are not a cause of learning disabilities. I think that definitely some of that does have an impact on readiness for school, but it is not a learning disability.
Right. And many parents are left feeling very guilty because they keep being told if you just would read to your child, and they're reading to their children all the time, but their child is still struggling.
Yes, it goes both ways. And learning disabilities are often hereditary and run in families. I think that you will often be, we have conferences here at our school where the kids talk about their learning, and a dad will be like, oh my gosh, I was like that when I was in school. There is a definite link to genetics when it comes to learning disabilities. And, I think this, again, the myths, more than 2/3 of parents polled thought that specific signs of learning disabilities were something that a 2 to 4-year-old would outgrow. Learning disabilities do not go away. I think what we do is we definitely can teach skills in proper ways, in very systematic, explicit ways, and kids can make improvements. They also learn how to strategize, use strategies to become successful in areas of passion and kind of make up for the areas that are more difficult for them.
Yeah, this is an important myth to debunk here, because I think that many parents, especially, feel like, well, if I just do this, it'll go away. If I just try that, it'll go away. Really, that's not the case. I work with many adults with learning disabilities who, is proof that it doesn't go away. We just have to learn how to accommodate them as we grow.
And it's difficult when you have a little one to really say, oh my gosh, there might be something going on here that I have to pay attention to, because everyone believes that their children are perfect, and in many ways they are. But the earlier that we can recognize the signs of learning disabilities and the earlier we can get support for the children, the better the outcomes are overall, which is what this next slide says.
Yeah, and that's my son. When he was 6 years old, he was diagnosed early, and now he's 23 and working his way through college. I'm not saying it's going to be easy for him, but he is. But yeah, the earlier you get it, the more success you could have later on.
And I think, we're on an earlier slide, we were talking about a lot of time the system is kind of a wait and fail. And, I can't tell you how many kids that we get here at the Howard School who come in and they have been damaged. They have decided that they aren't smart, that they're not a good learner. And I think undoing some of that damage takes a lot longer. And, they could have gotten appropriate interventions at an earlier age and kind of not had to go through that. But there's hope. I think everyone probably is noticing that there, all around us, there seems to be an increased awareness of learning disabilities, including dyslexia. I mean, I think there have been at least, there have been several states that have passed legislation in the recent past to kind of help further support these students on a state level. An area that is a huge passion for me is the use of assistive technology to help these kids be able to read information at their intellectual ability and be able to express themselves at their intellectual ability. A lot of times people make assumptions because a child, when they write, their spelling is poor. but they know how to use that word. They may just need like a word prediction to help them spell it while, and this is not a substitute for learning decoding ability, you know, decoding and encoding skills. But it is a huge booster to get kids exposed to language and exposed to reading that they otherwise wouldn't be able to be exposed to. Another area, you know, there's a lot all over the place of there are groups providing more teacher training, and we're really trying to focus on general education teachers. Again, if we can catch these kids early, and if the general ed teachers know how to teach structured literacy in an explicit way, a lot of kids will learn to read. Now, that doesn't mean the learning disability goes away, but they will be more successful in the classroom. And the educational dynamics are changing in a lot of places. We're seeing people try things with like STEAM and kind of experiential types of learning. And that those kinds of platforms really help some of our students who, you know, are not having to get all of their learning out of a book or all of their learning by sitting in front of a teacher at the front of the classroom just lecturing. This is just good teaching, and we're fortunate that it seems like a lot of places are starting to use some of these methods.
Okay, so what can we do? So we, as an advocacy organizations such as Learning Disabilities Association of America and the International Dyslexia Association, we advocate for really increasing the expertise of pre-service teachers at the university level. We need our teachers coming out of their training programs, understanding the signs and symptoms of learning disabilities, including dyslexia and related reading and written language disorders. We need our teachers to understand the science of reading and to understand what evidence-based instructional methods and practices are, and they need to be learning this before they step into a classroom. And that's something that we are strongly advocating for with both of our organizations.
Monica, can you explain the difference between research-based and evidence-based?
Right. Well, yeah. So when we say something is research-based, that means that someone has done some type of project, some type of research to look at the impact or the effectiveness of that program or strategy or method. A lot of research finds that you can't find significant differences or evidence that this program might be effective. So if we use the term evidence-based, that means we are really looking at what did the research say? Not just whether or not this method was researched, but did the research show that this particular method has evidence behind it, that it improves outcomes for students or mitigates the impact of dyslexia or other learning disabilities. Okay, and what can you do? As Jennifer already mentioned, there is a lot of legislation that is being passed, especially around dyslexia awareness and improved instruction and training for teachers and improved intervention for students with dyslexia. It's really wonderful that we have had such a focus on dyslexia. As we mentioned early on, dyslexia is the most well-known, probably the most prevalent learning disability, the most well-researched learning disability, but it's not the only learning disability. So dyslexia is a learning disability that impacts reading, but not all reading disabilities are dyslexia. There are also disabilities that impact students' ability to do math, dyscalculia. People with working memory deficits will struggle with acquiring math facts and fluency. So what we really need is that we all, as individuals, need to advocate for continued research so that we can learn as much about all disabilities as we know now about dyslexia, and we can improve our understanding of what interventions are most successful at mitigating the impact of these learning disabilities. And we can do that by being active, finding our voice, and calling our state representatives, our federal legislators, and we can make a difference just like folks like Decoding Dyslexia has made a huge difference around dyslexia.
Right, and to add to that, organizations like LDA and IDA, we monitor that legislation. We are constantly, up on what is happening in Washington, and through the state affiliates and IDA chapters, they also are monitoring what's happening within their state. So this is a very important part of what our organizations do, but it also needs to be an important part of what individuals, collectively can do.
Okay, and in our homes, don't be afraid to advocate for your child. Parents know their children best, and we are our children's best and earliest advocates. And sometimes it's difficult to go to, your school where you feel very connected and you like your teachers, but you feel deep down that your child's not getting what they need. You have to speak up for your child, and it's not being a pain in the neck. It's being a parent and doing what's best for your own children. And then we also have to teach our children, our students, how to advocate for themselves, right? Because those K to 12 years, or those pre-K to 12 years, are really short in someone's lifespan, and they will be out there in college where they will have to advocate. They might be able to get some accommodations in post-secondary education, in college, in the workplace, but they will have to advocate for themselves in order to access those accommodations. So we need to be teaching those self-advocacy skills to our children very early on.
Which also means that they've got to know a little bit about their diagnosis to be able to do that, correct?
Correct. They need to understand how they learn best, what their particular weaknesses are, what they struggle with, and how they can best work around those weaknesses.
I know, because I have many parents that will say, well, I don't want to tell them because I don't want them to feel bad about themselves.
Right. And we have to get to a place where we can all, right now there are many people speaking out about dyslexia, and that has become more socially acceptable. But all individuals with learning disabilities need to be accepted and understood so that they can speak up for themselves and be proud of who they are, right? Because having a learning disability and the struggles that go along with that are part of what makes us who we are as people, and about what we can deal with. So the more we can help people understand, our children understand themselves as learners and speak out about how they learn, the better off our whole world and society will be.
Definitely.
So both of our organizations, we really have come together because we believe that all of these individuals with learning disabilities really deserve the evidence-based identification and intervention as early as possible. And we're also resolved to work together to combat the misperceptions that lead to the stigmatization and unfulfilled potential of individuals with learning disabilities.
Oops, on mute. Right, and we want to work together to advocate for the diagnostic and prescriptive educational strategies and the models of support so that we can meet all students with learning disabilities where they are and to assist them in accessing their fullest potential. Because with this, we can empower our students, our teaching professionals, parents, lawmakers, to advance the standing of all who struggle to learn. So what else can you do? Well, I mentioned it earlier, you can support organizations like the Learning Disability Association of America, its state affiliates. We have 25 of those, and the International Dyslexia Association and its chapters. And how many do you have off the top of your head?
We have 43 branches in the United States, Canada. And
right, 40. And you have international branches.
We've got global partners, yes.
Right. One way to do that is to attend a conference. IDA has one coming up. You want to tell us a little bit about that, Jennifer?
Sure. It's actually going to be our 70th annual conference, 70th anniversary since the inception of IDA. We're going to be in Portland, Oregon from November 7th to 10th of this year. And we've really worked hard to put together a really strong program for professionals. We've added a lot for parents and for individuals with dyslexia. And we're really excited about the upcoming conference.
Yeah, so that's just actually not too far away, a month away. So, and then there's the LDA annual international conference. It's our 57th year, and it will be in Orlando, Florida, February 17th through the 20th. We're very excited that we have John King as our keynote speaker, Mary Brownell, and we have a husband and wife team from Landmark College, but we are also offering sessions for parents, professionals, educators as well. The LDA conference is much more focused on all the learning disabilities, including dyslexia. So, but if you want more information about either of these organizations, the website's up on the screen right now, dyslexiaida.org or ldaamerica.org, and also we encourage you to join both of our organizations to help us forward some of the initiatives that we have going on. So we are a little bit early, but did want to say if you have any specific questions for us, you can contact us on the screen in front of you now to let you know this webinar is being recorded, so you can listen to it again. You can share it with friends, families, other professionals. And you can also email info@ldaamerica.org. What is the general contact for IDA?
You can just email me and I can forward things along.
Okay. So, Erica, do we have some questions that we can take?
I do. I have one question. I've answered the replay questions. Yes, there's a replay coming. The next question that I have is from Sherry, and it's, if lead poisoning diminishes academic abilities, can this be considered a cause of a learning disability?
Definitely. LDA also has a program called the Healthy Children's Project, and in that part, through the Healthy Children's Project, they point out, lead-based I'm losing my words here. Monica, can you help me? So yes, exposure to lead can lead to learning disabilities. Environmental toxins can lead to learning disabilities. So people need to be aware of that. And through Healthy Children's Project, we do advocate for that, for the environment side.
Yes, as Beth just stated, yes, that environmental toxins, because we remember from early on in the presentation, we talked about how learning disabilities are neurobiological. Well, there are a lot of things that impact neurodevelopment in young children, and young children are very susceptible when their little brains are developing. So environmental toxins such as lead, and sometimes the lead might cause very minimal impact depending on when it's caught, and a child might not have a learning disability or any lasting impact. Sometimes it can cause a learning disability because the impact is limited, but after prolonged and extensive exposure, it could cause more overall cognitive impairment and intellectual disability. But yes, lead and other environmental toxins can be contributing factors to learning disabilities.
Okay, just a reminder that we have, I have another question. How can we better educate higher education faculty about making accommodations for students with disabilities, especially at smaller schools with very few resources for students with disabilities?
Well, I'll take the first response to this. I think, well, first of all, we need to know that not all colleges are the same in providing the resources, that the accommodations and resources that are needed. And it is required that they have a disability services department, but they're not going, there's levels of disability support services that they're going to provide those students. So if a smaller school does not provide those, then that might not be the right school for that individual because they're not required to do that. Do you have any input, Monica, being, you are at that level where you're in the educational institution at Temple? What are your thoughts?
Right. So, I teach as an adjunct in the school psych program at Temple University, and Temple does have a very strong program, disability support services. But I'm not going to pretend that it's not a challenge at a place like Temple, where we're a large university with ample resources. All instructors and professors are required to have training around accommodating for individuals with disabilities. But as Beth said, in some smaller schools with less resources, that might not always be the case. And there are resources out there, and including LDA and IDA can help you with finding a college or university that might be the best fit for an individual who has a learning disability or dyslexia. But it is an area where we need to continue to work and grow. And I can tell you, my youngest son just graduated from college in April, and in his first year, because students at the college level have to advocate for themselves and provide a copy of their accommodation plan. And when he did that before class, that professor announced to the entire class that he does not believe that anyone who needs an accommodation plan belongs in college. And, they're just not college material. And he would comply because he has to, or he would lose his job. But he made it clear that my son didn't belong. And my son did belong. He successfully graduated, and he just landed his first job yesterday. So
there's the hope.
Really the self-advocacy, arming these kids with the knowledge that they can succeed and they do belong, and they have their toolbox of things, of strategies that they can use to be successful. We had a former student who actually she works for us now at Howard, and she just went back to college, and a professor tried to tell her she couldn't use a laptop. And, she didn't do anything confrontational, but she wrote that professor an email that evening. And, I think it's really one person at a time, really educating them sometimes, that these kids are totally capable and belong in college, if they so desire.
Right. There are lots of different paths to take as well. But I agree with both what you've said, and I don't know if there's any way that we can actually make them do it, but it is the law. So if, just as Monica said, if that student has learned to advocate for themselves again and again, and it might take, I don't know, how did that work out for your son, Monica? Did he go back to him? Did he
Yes,
get those?
he did go back to him. He wrote a long email, and then he followed up with a personal conversation to explain, his struggles and how he accommodates that and overcomes that. He's not convinced that individual had a change of heart, but who knows, maybe in the future it will have an impact. But it's one person at a time that we have to educate. Right.
And probably in a small school has has to do with also the administration. So my son goes to a small school in Arkansas, and they have a comprehensive center at his school where he goes to get the services that he needs. But they are in constant communication with the administration of the school and the various faculty members, and if he has a problem, they help him advocate with that faculty member. So it's really communication and advocating for oneself.
And I think arming yourself. I think there are tools that kids can use for free. It's becoming kind of, a lot of these accommodations are in your iPhone. So I think sometimes you can, even if you don't want to have to work around a system, but you can if you know what you're doing.
Right. Erica, any more?
I don't have it. Oh, wait a minute. I do. Shouldn't we advise the college students to register their disability with the Disability Services Office?
Yes, maybe we didn't explicitly state that, but yes, that is necessary. And we talked about how students have to advocate for themselves. So yes, they need to register. They have to provide the required documentation, which will be the topic of a future webinar. And they do have to deliver those accommodation notifications or letters to their professors. And yeah, it's a process. And the earlier we can help kids understand what that process is going to be and what they're going to need to do to get what they need, the better off they will be in the post-secondary environment.
Well, and I think it helps to practice. We've started having our seniors sit down with an adult in the school to kind of pretend like they're walking into the disabilities office and have that conversation, because it's hard the first time you do it. So I think giving them an opportunity to really walk through what they're going to say and explaining why they need it, I think can also really help a student.
Yeah. Well, even going further back, my son attended a school where they did student-led conferences. I think that really helped him a lot in gaining that confidence as he got older. And it's not just in the K through 12 or in college. When you get out of college, you are on your own. So in the workplace, you also need to have those skills to be able to, advocate for yourself.
Okay, we have another question from Pam. Do you have a list of colleges which are accommodating for students with learning disabilities?
We can provide that list. Don't readily know if it's on our website, but if you want to email us, we can provide a list.
And if it's not on our website, we will work to make sure we get it there.
Yeah, I'm in Texas, and I know there are many on the LDA Texas website. I mean, I can list many off the top of my head, but I think more and more colleges are starting to provide those services. So that's the good news, is that as we create more awareness about learning disabilities and the potential of these students, we're going to have more and more colleges that are going to be opening up to these students, and so it won't be so difficult. But again, remember, all students are different. So, I mean, my son has multiple challenges. He needed somebody to hold his hand. There are others who don't. They just need to be able to go in and get the accommodations they need, and they're off and running. And then there are others, like Jennifer was saying, that, where the assistive technology might be the way to help them. So it really depends on the student.
Right. And just like you have to shop around and find the right fit for students without disabilities, it's the same idea for kids with disabilities. You just have another layer that you have to navigate.
Or more so. You need to probably be a little bit, a lot more diligent. Just because like I said earlier, just because they have a disability support services department does not mean that they're going to provide the same services as say, University of Arizona that might have a SALT program, which is specifically for students with learning disabilities.
Okay, so we have another question. Are we seeing any shifts in identification numbers with particular populations, like African American students, females, or later in life diagnosis of adults?
That's a Monica answer.
Yeah, and I don't know of data offhand, so I don't want to make something up. I don't know that we see a shift right now. You know, we definitely know that with people of color and minorities that there are issues of both over and under identification or misidentification. So there's definitely more attention being paid to that issue, to issues around disproportionality. But if I can't really speak to whether or not there has been a shift in numbers or percentages.
Yeah, that is an issue that both LDA and IDA, you know, are working hard to try and address those issues.
Sorry, I was busy typing and trying to keep up with how fast you both talk. I'm also typing either the timestamp or the answer itself into our answers, question and answers.
Oh.
So I don't have any more questions through our Q&A at the bottom of the screen. I want to remind the few people that we do have on the phone that if you hit *9, that will raise your hand and let me know you have a question, and then I can unmute you for that question. Also remind everybody that's on the web, there is a Q&A question at the bottom, a Q&A icon. And that's where everyone's been asking their questions for those of you who joined us after the initial statement there.
Well, I would encourage everyone who wants more information to go back to the websites on dyslexiaida.org or ldaamerica.org. I also encourage you to join either or both organizations. Also, we have information on our Facebook pages. The LDA for Learning Disabilities Month has a calendar that each week we have various activities and information surrounding learning disabilities. So look for that. So there's a lot of information out there, and know it takes time to sift through it all, but it's worthwhile, and it's worth sharing. So we really appreciate everybody that has come today, and look for the LDA's next web.
Wait, Beth, I have someone who's asked a question, one of our phone listeners, so I'm going to have to allow them to speak. I am going to unmute you shortly within a couple seconds. Your area code is 26626. And there we go. Oh, and there's a lot of feedback there. So my question, my statement, because there's a lot of feedback and we can't unmute you at this point, is if you could send your question in to info@ldaamerica.org. I will make sure that we get our panelists to answer that question, and we'll include it in the email with the replay.
Yeah, great. Well, do you have, Jennifer, Monica, do you have anything else to add as we wrap up here?
The only thing I would have to add is if you go to IDA's website, there are a lot of publications that we have that have information that's research based that you can check out. There's a publication for like practitioner level, there's one for more research level, and then there's also one for parents. So you can check those out as well. And find your local branch, because they're doing events all over the country, and you can actually find your local branch on our webpage. I'm sure LDA is the same.
Yes.
Yeah.
we have a lot going on with all of our affiliates, and I just want to say thank you to everyone who joined us today.
Yes, thank you.
Okay, well, join us next week where we'll have our next webinar is called the Documentation Disconnect. We'll get into a lot more detail on the evaluation and identification and documentation of learning disabilities. And Monica will be joining us again next week, along with Joanna Barnes. So until then, thank you.
Everyone.
Thank you.